so what happens is somebody will just be scrolling on a social media platform and they'll come across one of our videos. And at the time when they first come across that video, they're not anywhere close to the stage where they're ready to take action or even considering it. They're just like, okay, well, I'm bored, so I guess I'll watch this video about prediabetes. And then that leads to different questions that they have, which leads to them going to our page for more information. And before they know it, it's almost a snowball effect where they become more educated, they become more motivated.
You all are providing free video-based content for those living with diabetes, primarily via social media, to get out of negative feelings and to truly feel confident in managing diabetes and possibly even reversing diabetes. Could you walk us through the actual platform itself and how to use it and how users can navigate it?
Yeah, so like you mentioned, it all starts on social media. We're trying to meet the end user where they are. They're spending a lot of time on platforms like Facebook. And so the next step to that is really understanding how to communicate on those platforms, which we have an expertise in, making bite-sized videos that are entertainment first with fun graphics and animations that are pleasing to the eye, but also covering important topics, and not important to us, but important to the person viewing the content. So we did spend a lot of time on these social platforms, understanding what people were asking questions about, what problems they were facing, what obstacles that they've seen as too big to overcome, and we built our content around those topics. And so somebody can easily start to interact with our platform and our product by just going to our Facebook pages. As soon as they start to interact with that content, then the engagement process begins. We then can start to retarget different types of content that are similar to what they're interested in, right back to those end users, and slowly work that end user down a pathway where they become more educated and they become more aware of what resources are available to them so that they can regain control of their health. We do all of our content in-house, and we actually see our company more like a Netflix or a Pixar than a traditional digital health company. And so we look to hire great creative talent, people who have experience making the content themselves, but also who are well-versed and understand what resources are available to make really high quality content for much affordable than what was possible in the past. So that's a big focus of ours, is continually getting better at taking the outcomes-based curriculums that somebody with diabetes should experience if they go through a diabetes education program, and looking at it in a new way and trying to communicate those same topics in new ways. We are able to engage people at a much earlier stage. And what I mean by that is there's this full spectrum of people with diabetes, and most of the people who are taking action are further along the spectrum. So they're in that top 5 to 10%. They're ready to take action. They're looking for resources. And companies like Google and Amazon really understand this principle and apply it to our consumer habits when we purchase things. But the same underlying principle applies in these with chronic disease programs, and how we can engage more of the populations who currently aren't engaged. And so what happens is somebody will just be scrolling on a social media platform and they'll come across one of our videos. And at the time when they first come across that video, they're not anywhere close to the stage where they're ready to take action or even considering it. They're just like, okay, well, I'm bored, so I guess I'll watch this video about prediabetes. And then that leads to different questions that they have, which leads to them going to our page for more information. And before they know it, it's almost a snowball effect where they become more educated, they become more motivated, and then they're taking action. And so I think that's where we're actually really unique, is our ability to be further upstream and being able to engage these people when they're not really looking for that coaching yet or for that new device yet, but they're just kind of passing the time. And as they pass the time, they become a little more motivated and educated, and slowly and surely they prepare to take action. And so right now I do want to be clear, we're doing both English in the US as well as Spanish in Latin America. Of course, COVID's kind of halted the Latin America efforts that we had built some momentum on, but we're fine with that because we have momentum here in the United States as well. The big reason that we had a big focus on the Latin America side of things, so our Spanish speaking community is about 40,000, our English speaking community is about 10,000 people with diabetes. But it was just a matter of reception. So we're putting both English and Spanish content out on these social platforms, and the Spanish content was just getting engaged with at an unbelievable rate. The English content is doing very well, and we're very proud of it, and the program continues to develop, but the Spanish content just completely blew us away. It was one of those things where we put out a video, we wouldn't have to put a lot of effort in regards to financial effort behind that video, and it would just take off, and the people would share it and they would comment on it, and then they would engage with us. And so what that opened our eyes to was just the lack of access and the lack of resources for this specific population. And so that's something that's on our mind, and we continue to push our Spanish page and grow the Spanish page. And it'll be really interesting as COVID kind of subsides and we find solutions to that and we can start traveling to other countries. I'm very interested in how we'll be able to collaborate with the health plans in Latin America and the device companies and different partners that will be available to us because the reception has been so great. And so when it comes to engagement and working with people directly who have diabetes in the region, that's been something that's blown us away, how willing they are to use social media just to find the resources and find the guidance because it's been missing for them for so long. We've got a big announcement coming up very soon. We'll be closing with our first health plan. So really excited about that, to be able to show our value and deliver a return on investment for them. We've got another pilot that we've already announced with a partner of ours, Biotel. We are going to be expanding. I won't really get into the details of how we'll be expanding, but very excited about that. So both on the health plan side and on the device partner side, we're seeing progress. We're continuing to make strides and our partnerships are growing. So for us, we want to really execute on both of those partnerships throughout 2021 with the goal that by the end of this year, we're able to start scaling to both other health plans and other device companies and replicate what we're doing for them to multiple other customers. Yes, so you can go to diabetescare.io. If you go there, you'll get a number that you can text and start getting diabetes education immediately. Or you can look up Diabetes Care on Facebook. And if you go there, you'll be able to start scrolling and start getting diabetes education immediately for free as well.